morning, everyone. Welcome to our weekly vlog. We're going to kick it off this week. Today is Sunday. For those who are new to my channel, welcome. I am Nurse Lainey. I'm going to be starting another series, or really continuing it, but it's a new start of weekly vlogging some of my work weeks. So that's what we're here to do today. So today is shift 1 of 4. I work 4 days this week. I work Sunday, Monday, Wednesday, I think, and Friday. I'll have to double check, but I think that's what it is right now. I for sure work Sunday and Monday. So it's going to be a little bit of an adjustment because this is going to be different from my other come to work with me videos that I used to do. So I'm going to figure out how I want to do them, how I want to edit them. So just come along for the journey. If things change, that's just what I'm trying to do. I'm trying to see what I like, and then once I get like a format that I like, then we'll stick to it. So a lot of days I really have a lot going on, and I think I want these to be almost an hour, but I don't want it to be too long. So I think I'm going to just concentrate on one patient, especially for this first one. We'll see how it goes. If I don't like that, then I will change it again, like I was saying. So today I'm going to be talking about one patient. So today I am COVID IMU. For those who are familiar with my unit where I work at full time, it's the COVID unit and also the IMU unit. So today I have a combination of COVID positive patients that are also IMU status. So I have 3 patients. One of my patients that we'll be focusing on today, what's been going on with her, she originally came to the hospital for acute respiratory failure. She's actually doing okay on that part now. So she's on 3 liters nasal cannula. The problem with her now is that during a night shift, she became very lethargic. The night shift nurse had her previously, so she knows like her mentation is normally alert and oriented ×4, which means to person, place, time, and situation. So normally she's like can respond. She'll like answer you when you're talking, like she's completely with it, like you and I are. But overnight, she became super lethargic. They thought she was just asleep, but when they tried to like arouse her, she was not responding. So they did labs and stuff on her. Come to find out her ammonia level is 115. She does have a past medical history of liver cirrhosis, which accompanies that. So what we're trying to do is get her some lactulose to help bring the ammonia level down. So the problem is, since she's not with it, she cannot safely swallow. So we had to insert an NG tube this morning. Now she can't eat or drink anything because she's at risk for choking. So we got the NG tube placed this morning around 8 o'clock. We had to get an order for restraints because she was trying to pull it out. So that all happened this morning. Right now it is 9:45, so that's all already happened. I've not been able to give her a medication yet because I'm waiting for the x-ray of the abdomen results to confirm where the NG tube is placed at. So what we're doing, once that is done, the results come back, I need to call the doctor to verify that I can start using the NG tube, and then I can medicate her with her morning medications. This patient also has a history of diabetes, so she is ACHS, which means we check her blood sugar normally before each meal and then at night. So since now she's not eating or drinking anything, I have to also ask the doctor if it's okay for her to like get her scheduled insulin. Normally she has Lispro scheduled 10 units and she's on the sliding scale. So according to her blood sugar this morning, I should be giving her 14 units of Lispro. So since she's not eating, I need to confirm that with the doctor that it's okay to give. She also has 50 units of Lantus scheduled for this morning as well, so I just need to clarify that. I'm talking like, I don't know if I'm talking really fast, but I'm out of breath. I've been moving around a lot this morning. But yeah, so that's a lot, pretty good amount of insulin. I think her blood sugar is like 182 or something, so I need to confirm with the doctor that they want me to continue to give that. And I think that's about all that I need to do with that doctor. So I'm just waiting for the results to come back so I can ask him everything at one time. So that's where we're at with that. I'm also getting an admission, so I'm going to show you guys how I set up my rooms and what I bring into there really quick. And then also I had to set up suction for this patient and PureWick, which is pretty much the same setup, but it's just a different end on it, like end of the suction thing. So I'm going to show you guys that briefly, and then later I'll come back with an update. Y'all, it's 4 o'clock. I haven't eaten. Well, it's really 3 something. I'm going to give y'all like a full breakdown of what happened because a lot has happened. I had to call a rapid down at MRI on my patient. So from ER, well, from MRI, we went to ER. We did some stuff, then we went to ICU. So I'm coming back from ICU to my unit. So I'll give y'all an update at the end of the shift. What is up, you guys? We made it to the end of the shift. Thank God. I had to transfer that patient to ICU. My new admission. I don't even think I got to tell y'all about that one. But I'm going to update y'all first on... Sorry, my eyes rubbed them. Anyway, I'm first going to update y'all on that patient that we were focusing on at the beginning of the shift, the one with the ammonia level. Basically, the first time we did the x-ray of the abdomen, it showed that the NG tube was coiled in her stomach. So what I did is like I untaped it and then like drew it back some and then advanced it again, retaped it, got another x-ray of the abdomen, and then it confirmed that the placement was like correct. So with that, like it took them so long to get the results back for me. So I didn't end up being able to medicate her with anything other than IV stuff till about like 2 o'clock, I'd say. But nothing really came of that. When we put the NG tube in, I was able to actually administer the lactulose. So they'll recheck her ammonia level tomorrow because they have lactulose and stuff to give her as well. And we'll see if it has come down some and maybe she'll be a little bit more alert. So we go back to her tomorrow. So when I go back, I should have her again and then we'll be able to see if anything came of it. Now, I showed y'all me getting my room ready for my new admission from ER. So I got a report on this patient. They were saying she was coming in because the husband was thinking she was having signs and symptoms of a stroke. She had past medical history of a stroke. And she was like having shortness of breath. So when I got her, she was a COVID rule out patient. So her labs are still pending in regards to COVID. She was on heated high flow, 35 liters, 60%, which is pretty much on the low end. And when I got her, or rather, let's talk about in report, my report wasn't accurate unless she changed that quickly. They said her blood pressure had been high, like 190. So they said they were going to give her labetalol before sending her up. And I think they also told me that she had like a low-grade fever, so they were going to give her Tylenol. So y'all saw me get my room together and everything, suction, all that stuff. They did tell me she was having like nausea and vomiting, so they gave her a Zofran for that. But when I got this patient, you guys, it was like not at all what I expected. Like this patient should have probably been in the ICU from the beginning. her blood pressure was like severely elevated. It was like 240 something over 100 something. I'm gonna do it again like I've done in some of my other vlogs. I'm gonna insert the note while I'm talking about it so that y'all can see like what I'm talking about. I think I want it on this side. I'm going to insert the note so that y'all can read it while I'm trying to say it to y'all. So we blood pressure severely high. I waited like 15 minutes because we were moving her around. She just vomited. I'm like, maybe it'll go down. It did go down a little bit, but it was still too high for my liking. I contacted the doctor like literally right away, and I was like, if she doesn't respond in 5 minutes, I'm calling the doctor quick, because like that's too high for her to be like on my unit and like nothing is being done about it. Like that's stroke level blood pressures right there. So instead of doing that, I actually called the ICU NP, nurse practitioner. So both of them actually got back to me in a timely manner. So the nurse practitioner actually ordered a labetalol 20 milligrams IV, and I actually did drop my blood pressure down to like 170 something, which is good, because after talking to the patient husband, he told me that they allow for permissive hypertension for this patient in particular, which normally at home they keep it between 170s and 200s. So it was still too high for their parameters, but you know, it was like supposed to be like on the higher end. So that happened. I'm like trying to get admission stuff done with her. They ordered labs, they ordered all types of different stuff. I was telling the doctor how she was like, I was like, what's her baseline mentation? Like, how was she when you saw her in the ER? And I like described to her how she was for me, which is like not alert oriented, and she was like very like lethargic and dozing off when I'm talking to her. And the doctor was like, she wasn't like that when I saw her. So she came up to assess the patient. Thank God I had like a timely MD today, because today could have went really wrong with this patient. She was vomiting so much. I'm so glad I set up my suction. So that's a little tidbit for y'all people, like new nurses. Like, people don't tell, like nobody told me to set up that suction. I just decided to do it just because she was on heated high flow. And I don't know, just in case. And just in case was good, because as soon as she came on my floor, she was like throwing up, and RT had to use it. She was vomiting a lot, y'all. And she was not like turning her head to the side to do it. So she literally could have really just aspirated on her own vomit. So I'm glad that I had that set up. They ordered all these labs on her: CT head, CT angio, head and neck, MRI, all that stuff. So we went down to get those done. I was literally downstairs for 2 hours with this patient. I had so much help today. I had to tell my team, like, shout out to y'all, because I don't know what would have happened to these patients if I didn't, like, I had to ask for a lot of help today because I had so much going on. So I delegated some things, and then you know, I did or whatever. But it, like, I was like between two staff nurses asking them for help in my charge. So that just tells you how many people were involved taking care of these patients. So I was downstairs getting the CT head done, all that stuff. We were literally coming out of MRI, and she started like vomiting, or like expectorating. I think is how you pronounce it. Pink frothy sputum. I've never seen that stuff before in real life. Like I see, like I hear them talk about it with pulmonary edema. I know about it, but I've never seen it. And literally that's what it looked like. It looked like foam, like pink foam coming out of her mouth. I was like, what the hell? She was desaturating on the non-rebreather to like the 70s. Like, I just saw her numbers keep trending down. So I was trying to figure out, like, is there a leak? What's going on here? Why is her oxygen saturation trending down? She's not doing anything. I don't know. Too much was going on with my lady. That was happening. Like, her right face started to droop. And me and the MRI guy, I was like, can we call a doctor quick? So we couldn't actually call a doctor quick in the MRI room. So we had to push her across the hallway to where the ultrasound room was. And then they called it from there. And then from there we went to ER because they thought they were going to intubate. And like everything is in the ER. So instead of running back and forth, they just moved the patient, right? So they did so much stuff down in the ER. And I kind of stayed out their way because ER knows how to work with ER people. Like, they placed a Foley, they placed another IV line, they started her on a nitroglycerin drip, they placed her on BiPAP. Like, it was just a lot of stuff going on. So I was just like really grateful, like, because I was like, I need help. I need help. I need help. So after they did all that and kind of stabilized her, I transferred her to ICU and gave her the ICU nurse report. So that was like my day, guys. I'm like so tired. I'm ready to go home. I already would have been gone, but you know, I want to keep y'all in the loop, update y'all on what's going on. I am back tomorrow, though I don't want to be, but I will be back tomorrow. My husband bought me some sushi. I'm about to drink some red wine and I'm going to sleep. Okay, so I'll see you guys tomorrow. We'll see how it goes. You know, I'm really hoping my next shift is nice, because I'm like, today though, I didn't eat lunch until like 4 something. I don't appreciate it. Hey everyone, it's day 2. Y'all missed the whole shift because I was busy again. So my other patient that I had that we were concerned about yesterday, they were the ones, the ammonia level, it went up last night to 155. So I had to give her lactulose enema and all this stuff. So they ended up transferring her to ICU because they were like concerned. She was like not as oriented today as she was yesterday. But you know, she wasn't oriented hardly anyway. I feel like it was even worse today. So the doctors were like, let's transfer her to ICU. Oh, my sheet came untied. So that took up most of my day. Once again, it took me 2 hours to get an ICU bed. So she was with me. And I was just like, here I am with the ICU level patient, and I have 4 patients. I'm like, this is not safe. It's really annoying. They ordered all these labs on her, of course. So it was like, I was waiting to see if she was going to move, but it took so long. I was like, let me just go ahead and do them because I don't want to be a delay of care. So I did mostly everything. I was only pending like a straight calf. So I'm just glad today is over. I am sick of it. If y'all remember yesterday, I was supposed to work on what is it called? Wednesday. I moved my shift for my PRN job to Thursday because I just cannot. So the next time you guys will see me, it'll be Thursday, and then we have another shift at my full-time job at Saturday, and then that will be the end of the weekly vlog. Today was so busy, like I couldn't even hardly talk to y'all. That's how busy it was. So I will see you guys Thursday. Good morning, you guys. We are at my agency job today. So if you are familiar with my vlogs, you'll know that I don't know where I'm going when I get here. I go to the staffing office and they tell me. So let's head inside and see what's going on today. All right, so I'm in the IMU today, but these elevators are like staff only. So I'm waiting for someone to come by so they can scan me in, because they won't like go up without someone scanning their badge. So all right, guys, so I mentioned that I'm in IMCU today, but I also found out when I got up to the floor that I'm actually taking, like, I'm a tech. So that's cool with me. Get everybody blood sugar, go about my day, clean them up, whatever. So I'm about to head out there to, normally I know at these facilities, the techs come earlier. So I'm going to try to see who the tech was last night so I could go ahead and get a report and get started. So you guys, really quick, because I'm in the middle of things, but I want to update y'all real quick. I'm not a tech anymore. I actually have 4 patients. They switched me and another nurse, so now she's a tech and I'm taking patients. So I have IMU patients. There's 4 to 1 here. So all of mine are COVID positive. They're IMU, and I will come back to y'all in a little bit. All right, you guys. So honestly, my patients, like, there's not much at all going on with them. I really hope it stays like this throughout the day. Like I mentioned before, I have 4 COVID positive patients, so we're really just hanging out. You know, the same types of medications I normally get for them, steroids, remdesivir, that sort of thing. Actually, 3 of them are COVID positive. The other one is just like a chronically ill patient. She's not alert or oriented at all. She's like nonverbal. Tons of wounds. She has a PEG tube, a trach, dialysis catheter, midline. So like, but she's no trouble at all because she just lays there. So I'm pretty much chilling today. I really hope that it stays like this because y'all know my last 2 shifts in my full-time job was a hot mess. So I'm just like, be nice to me, please. All right, guys, so we're going downstairs to the kitchen to try to get my patient's tube feeding. They changed her diet like in the middle of the shift, so they asked me to come pick it up. So let's see if I get lost. All right, y'all, I'm gonna have to try to be quick because everybody go be trying to be coming in here because we all leaving around the same time, and my friend gonna call me in a little bit. So my chronically ill patient that I mentioned before, she ended up having like blood in her stool. Like it was pretty plain and visible for me to notice, like she has blood in her stool, but you still have to get like a fecal occult blood stool sample. I can't speak anymore. So I did that, called the doctor, got an order to do that, notified GI doctor. I actually couldn't get a hold of the GI doctor for a while. And then I found out from the nurses here that with that particular doctor, you have to call him on his cell phone and not through the answering service. I don't know why he doesn't answer. I don't know why he doesn't answer the answering service. But anyway, that's what I had to do. And then, he ended up putting in all these orders: IV Protonics, Cytotec, and Sucralfate. So a whole bunch of like, what's it called? Proton pump inhibitors. Almost everything to do with the GI system, really. Huh?
At the end, the nurses will.
Bye. So they be remembering me from the last time I was here. It's so funny. No, I'm off. Oh yeah, Happy New Year to you too. I forgot. So yeah, that's what happened. I gotta return my badge. So that happened with my patient around like 5 o'clock. No, actually after 5, because at 5 I was like done with all of my stuff. So that happened after 5 o'clock. Of course, that's when everything happened. Not the incident with the stool, but with the doctor actually responding to me and giving me orders. I had called about that earlier. But so there's that part. Then this other nurse, she was giving her patient blood and the IV started leaking. So like they called me in there to try to help get an IV started. And of course I couldn't get one started. But it was like me and this other nurse, both on each side of him, trying to start an IV at the same time. So neither one of us could get one on him. So what they're gonna have to end up doing is like putting in a midline on him. So that's what they're working on now. And then I gave shift report, did all of that stuff. And then like a nurse that was supposed to come in tonight didn't come in. Like we were all waiting for the same nurse. And I told the charge like, hey, have you heard from this nurse? Because I don't think they're here yet. And the reason why I said that is because when I looked, I saw that his paperwork was still like at the front, like where they put your assignment sheets at. So I was like, hey, I don't think he's here yet. So she called him, and apparently the nurse was like, oh, our manager told me I didn't have to come in today. I can come in tomorrow. And the bad thing is they were already short. So that just made it worse. Yeah, so they were already short. Like some of the nurses are 6 to 1, and then the charge nurse has patients. So like with him not coming, it just made it even worse. So she was trying to call the manager to see like what's going on, but the manager wasn't answering. So in the meantime, she had already called the guy and was like, oh, hey, you know, I thought you were working, blah, blah, blah. And he was like, no, the manager told me I didn't have to come in. But he was like, if you need me, I still come in. So he's going to end up coming in. But at this point, it's like 7:30 when he was saying that. So she was just like, go ahead and write your report and then y'all can go. So fun. Today, all in all, was a pretty good shift, which is like much needed after those 2 crazy shifts I worked. We got one more shift for this week. It's going to be on Saturday, so we'll see how that goes. Good morning, everyone. It is our last shift of this vlog, thank God. It seemed like this week went by so slow. So today is Saturday. It's also a holiday, so hopefully today is pretty chill. I'm like really crossing my fingers because y'all know how this week has been. My last shift was like better, but still I'm just like, okay, I'm just ready for this to be over with. But I'm back at my full-time job today. I have 3 IMU patients. They're all COVID positive. They're all on the heated high flow. The one to watch is one of my patients is on 60 liters, 85%. So they're almost at the maximum amount that we can really have on this floor technically. So we'll be watching him to see like if he needs to be transferred to ICU essentially. The other ones kind of have some wiggle room. So of course, I'll be keeping an eye on everyone, but that one in particular is the one to watch. So I already checked on all my patients, like make sure they were still good. Also, just checked over them to see if there's anything they're missing. So per usual on this unit, they're all missing these incentive spirometers. So I'm going to go place them on their carts, fill my carts up with the gowns and gloves and stuff, and then I'm going to go eat breakfast real quick. So I'm probably not going to pass meds to like 8:30 just because I'm tired. I don't want to be here. So we'll do that 8:30. All my patients are still asleep except for one. He's like not having it. He's like kind of irritated because he said he didn't sleep last night. So the rest of them are still resting. So I'll let them sleep in. So that's what's going on today, you guys. I'll keep you updated throughout the shift as always. What's up, y'all? I did not update y'all throughout the shift. Honestly, forgot I was vlogging at some points, but honestly, nothing really happened today. Today was pretty chill. Praise God, because y'all know how it is. So my last 2 shifts of the week was chill. So as y'all can see, I'm not in my car. I'm in my father-in-law's car. We have a wedding to attend, so I'm going straight to the Airbnb from work. So Jordan already got all my stuff I put my stuff in one spot and he brought it to me. So that's where we're headed now. So hopefully you guys enjoyed the weekly vlog. Like I said, I might be changing it up depending on how I feel or what I think is best, and what y'all comment down below if y'all like it or whatever. So yeah, I hope y'all enjoyed it, but if not, we'll get it together, okay? Go ahead and like this video, subscribe to my channel if you are not already subscribed. Join the team, you know what I'm saying? Comment down below if you got something you want to say, and I will see you guys in my next one.